Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. In this segment, we're going to be speaking with Dr. Katherine Iscoe. She's joining us here from Advanced Human Imaging to talk about the technology that enables users to take vital signs and detect warning signs for many diseases using their smartphone. Welcome to Health Professional Radio. Dr. Iscoe, thank you for joining us.
Thank you very much for having me.
Give our listeners a bit about yourself. Let us in on your professional background a bit and talk briefly about your current role at Advanced Human Imaging.
Well, with a current role, as you know, it can definitely change day to day. So on today, I guess my answer would be a conduit of information. So really, this company doesn't exist without the team. So I'm the point person to gather that information, and I make decisions based on this information to drive us to our North Star, and of course, navigating the bumps along the way.
Talk a bit about your early involvement in the company, if you would.
It's funny, when I think about it, it was so long ago, and I think to myself, was that actually me? But it was. I was actually the original CEO. It was a very small team of 4 people, and I worked in particular synergistically with my partner in life and partner in business. And we worked very well together because my background was primarily science and he had a very strong capital market knowledge. So it was kind of like the yin and yang, which we worked very well together. And like many other startups, we all wore many different hats, from making sure that there was toilet paper to communicating with investors. We started as a B2C company, and as the story goes, it grew from there and then evolved to what it is today.
How has your academic background influenced your work at Advanced Human Imaging?
It's interesting because similar to any technology of today, there needs to be a balance with the intelligence of technology and how it's used with humans. And that's the beauty, that's the dance between technology and humans. And that was really the core of both my master's and my doctoral programs, which I looked at implantable biotechnology. So this is technology that has a tiny little sensor and it's put just underneath the skin to measure a different kind of sugar. It's called interstitial glucose, basically sugar that's found surrounding the cells. The interesting thing about this technology is because for a person with type 1 diabetes, they have to know how much sugar is in their blood. This was a pretty accurate measure of that, but not super accurate all the time. So I tried to figure out, okay, how can I make this technology work better? But most importantly, how can humans use it in the meantime? And that's really the same thing that we're doing now. Is we have this beautiful technology, and that's the only way I can explain it because it is beautiful. But the question is, how can we make it work as beautifully as possible within humans? And that's really my background and how I'm applying it today.
I mentioned that you had smartphone-based human scanning technology that could detect a range of early warning signs in many diseases. Talk about this proprietary technology that you have there at AHI.
So we have developed an on-device capturing technology. And how this works is we use the phone's camera to capture images of the human body. So this could be the actual body or it could be the face. And we take the information that's stored within these images and we process this information within our device. So no information ever leaves the device, which is important for privacy. And the output of this processing is incredibly accurate data. And these data are used to provide things like circumference measurements, such as your waist or your hip, which obviously can change depending on whether it's Christmas or if it's bikini season. Yeah. But we can also combine these measurements, such as your waist to hip ratio, which then starts to delve into health risk markers. Other outputs can be things like blood pressure and heart rate variability.
Now, all of this is based on your smartphone simply from taking a picture. How does the software determine if something is okay or if something isn't okay?
So that's all done within the tech. So we have an incredibly smart team that has refined the software to determine, for example, is the background not right? Is the way that a person is standing not right? Is the light, for example, with the face capturing, is it too dark on one side and lighter on the other? So this is all being refinements within our team. But the core, I guess, would be the KFC secret sauce. That's really the amazing attribute of this software.
Is this software compatible with any body type, any condition?
So we've done several different validation studies, and as we go on, the more data we collect, the more accurate it gets. We started off with the quote-unquote average population, which I hate using that word average because I don't think it really represents humans. We are all different, beautiful shapes and sizes. But as we got more data from different populations, this feeds back into the machine learning, and basically the internal intelligence gets smarter and smarter, and that way our accuracy improves over time.
Now, you mentioned that you started out B2C and now you're B2B. Do you ever offer this technology direct to customers or consumers, or do you offer it to other companies who then give the technology to consumers?
That's right, the latter of the two. So we offer it as a B2B2C solution. However, the interesting aspect of that is that you still have to know both populations, because there's one thing about obviously working with a company, but we also have to understand to a certain extent their market as well, so we can help them use the technology as effectively as possible.
You've got a steady stream of deals with companies. Talk about some of your recent collaborations, some of the developments as far as your partners are concerned.
Most recently, unfortunately, but I guess also fortunately because of COVID, the importance of telehealth and remote care has been expedited. So doctors and telehealth providers really are looking for ways to monitor, assess, and treat their patients more efficiently and more effectively. So, for example, JAX is a UK-based doctor. It's a doctor booking platform, and they're looking for ways to better arm their doctors with real-time data. So doctors almost can get a jump start with their patients prior to a telehealth appointment. So a lot of our recent deals have sort of, moved into the telehealth space because of the importance of really being agile with this pandemic. And I think we're never going to go back to, in-person care after this. So I think this technology is such a great tool for that.
Is there anything that you'd like to add briefly before I get a website where our listeners can learn more?
I think the only thing to add is that I'm incredibly excited for the future, and couldn't do it without our team. So I guess a shout out to our team, our amazing team.
And a website where we can learn more.
Sure thing. It's ahi.tech.
Well, I appreciate you lending us some of your time. Thank you so much for joining us here on Health Professional Radio, Dr. Iscoe.
My absolute pleasure.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Katherine Iscoe, co-founder, CEO of Advanced Human Imaging. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.